Okay, so welcome everyone to another one of Wellspring's Be Well Wednesday talk. So we're really glad you were able to make it today, and we're excited to give you a very informative and educational presentation. So I will have Linda pull up our slides, and we will jump right into things.
All right.
Perfect. Okay, so just a little note, this talk is in recognition of September being National Prostate Cancer Awareness Month. So we are very happy to be presenting on this topic. And just to make sure you are in the right space, the title of today's talk is called The Core Connection, the Why and How of Your Pelvic Floor. So if we could have the next slide, please.
Oh, now, of course, it decides to not move
Gotta
along.
love
There we go.
technology. Oh, perfect.
Okay.
Okay, so I'm very, very pleased to have Linda McClatchy here today with us as our presenter. So Linda is an experienced physiotherapist with extensive training in musculoskeletal and pelvic health physiotherapy. She is credentialed in the McKenzie system of mechanical diagnosis and therapy and teaches this system to the senior physical therapy students at the University of Toronto. She's worked in Toronto for many years and in 2017 opened her own clinic in Mississauga called Elevation Physiotherapy and Wellness, where she works extensively with men and women experiencing musculoskeletal and pelvic health issues. So we're very excited to have Linda here with us today. And Linda, I will pass over the mic to you.
Thank you so much. And it's really great to be here and speak with everyone today. We are going to talk all about the pelvic floor group of muscles. So I have my model here because I just want to illustrate as we go on a few things in 3D, and then there'll be time for questions and that at the end. So the pelvic floor group of muscles, it's fair to say they're a mystery to many, or people often go their life without thinking or knowing too much about them. But the pelvic floor group of muscles, they work like every other muscle in your body. They're just inside. And like all muscles, they respond to work and to loading and to strength training. And so let's get into the details. So, we're going to talk a bit about the where, what, how, etc. And at the end, I'm going to give you kind of a little bit of homework to try to do and get the pelvic floor moving. But I just want to explain a bit about the reasoning around that first. So this just to outline kind of a few things in 3D, as I said. So this being the front of the pelvis, if you were standing in front of me, the very front part of the pelvis is the pubic bone right here, and it sits quite low. And then if we're looking inside here, this at the front, right behind the pubic bone, that's your bladder. And so for women, obviously your uterus, fallopian tubes and ovaries, and then this would be your rectum at the back. So your intestines would swirl up here. But I guess my point is that the organs sit in the bowl. And again, this being the pelvis. If you were on your back, there is your urethra, vagina, anus. And this then kind of slinging front to back, pubic bone to tailbone would represent your pelvic floor group of muscles. And there's layers of them. So I'm going to come back to the bladder and these organs. We're going to get rid of the rectum for our purposes, but looking at this bowl, so there's the front. And when you get rid of the organs, that bowl that's kind of underneath there, that would represent your pelvic floor group of muscles. And they sling front to back, and there's other ones that wrap around the hole, so they act like a sphincter. So the core, I would say this, the pelvic floor muscle, they don't end like they do on this model, of course. They blend very directly with the rest of your core. And the core that everyone talks about, you've got your two sets of abdominal muscles on the front, you've got your obliques on the sides, and you've got your deep back muscles. So think of that like this canister where the pelvic floor is the base or the support system. And in life, they all work together. So I want to say that the pelvic floor muscles, they're a bit magical. But why they're important is they have several functions. You know, these muscles, they attach, again, pubic bone or your pelvis at the front, and they sling right underneath, and they attach out by your hips and your spine. So they have a real kind of support and stability function. And you need a strong base of support for things in life for them to stay balanced and whatnot. And the pelvic floor, as I say, think of that as the base of your core itself or your trunk. And because other parts of the muscles wrap around the holes, so to speak, they can act like a real sphincter to help squeeze around that. And that's important for people who leak urine, say. As soon as you get muscles working and it helps to bring blood flow locally, it can act like a sump pump. It helps to move blood and lymph along through the system. And finally, it can have a sexual function as well. The strong pelvic floor helps with sexual pleasure. So what can happen here? There is a host of things that the pelvic floor can be helpful to either mitigate or help improve or fix. You know, as a physiotherapist or working the pelvic floor can't help somebody who is experiencing a bladder infection. Say medical issues need to be fixed or ruled out. But things like urinary incontinence, people that leak when they cough or sneeze or laugh or jump or run, urinary frequency or urgency, pelvic organ prolapse, dyspareunia, and vulvodynia. So these are all things that we're going to talk about in more detail. What I didn't mention on this list are pelvic health physiotherapy for men. So as an example, I see tons of men after they've had to have their prostate removed, and all of them will leak urine for a period of time. And the surgical techniques that they have now are so much better than they were. And these men can get completely better, and they get better way faster and probably more completely when they get their pelvic floor and the rest of their core good and strong. I do not see a more motivated person than a man who leaks, and they all do their homework. It is common, pregnant or postpartum women, it is in their best interest to get their pelvic floor good and strong. It helps with delivery, and it helps with recovery. So we're not going to focus on those populations, but if any of you have questions around that, I can certainly elaborate on them. So we're going to focus on these on this list here. So urinary incontinence, it's very common, and it would be fair to say that most people don't work or pay attention to their pelvic floor muscles, so they aren't particularly strong on most people. They work like every other muscle in your body, meaning they need to kind of engage and release appropriately. They shouldn't have any problem turning on, and they shouldn't have to melt over several seconds. Any muscle in your body needs to be kind of on and off on command. It shouldn't have difficulty with either of those. And there's lots of people, statistically speaking, 50% of men and women, because the pelvic floor on the inside, they're the same. And so lots of men and women, it's like their brain doesn't really compute with how to properly engage their pelvic floor. And there's other people where they can engage it appropriately, but they need to learn to turn it off. And so it's important that people can turn on and off their pelvic floor appropriately. And then, as I said, there's a few different kind of strengthening moves or endurance type exercises to train them to behave better. So it's important to do Kegels properly. Kegel exercises is just the term given to directly working the pelvic floor. And they're called Kegel exercises because back in, I think, the 1950s, Arnold Kegel was a gynecologist, and he's the one that first started paying attention to these muscles and asking his patients to do certain exercises and see how their symptoms changed over time. They're just named after him. So with different Kegel exercises, it's important, of course, like anything, that you're doing them correctly. So the gold standard for pelvic health physiotherapy is an internal assessment, men and women, and it's not it shouldn't be painful. It's just literally there's not a lot to see on the outside. So if I were assessing somebody, we would go through kind of the mechanics of how to do things, and then I would internally just feel as they're doing their exercises, so that I can know that both that person and me would know that they're doing it correctly. They can engage and relax appropriately. And then as they're repeating a bunch, we can talk about their strength and their endurance and their control in that muscle, and then see how that changes with time. So people can read about how to do things correctly or hear about it. But it's fair to say that most people wouldn't continue to do things unless they know for sure not only what to do specifically, but to know that they're doing it correctly. So with incontinence, urinary incontinence, this is the bladder here. So this is going to represent our bladder, and the tube that drains the bladder, it's called a urethra. And so the pelvic floor would sit right here in life. And I'm trying to get my head out of the way here. And so if we're taking coughing or sneezing or laughing as an example, there's lots of people that will leak a bit of urine with those activities, and that's called stress urinary incontinence. So if we just take sneezing as an example, when you sneeze, that really increases your abdominal pressure. And so what your brain does is make your pelvic floor muscles contract right before you sneeze, so that it more effectively squeezes around that tube, the urethra, because this urethral pressure needs to be more than your abdominal pressure, or it's coming out, because fluids flow high pressure to low pressure. So stress urinary incontinence, the pelvic floor muscles just don't effectively squeeze enough around the urethra. It's just not strong enough to overcome that pressure differential. So as people get strong and better endurance through here, it will more effectively squeeze around there to overcome that pressure change, so that they don't leak in the same way with coughing or sneezing or running or jumping, that kind of thing. Urge incontinence, that's a different thing, and it's treated differently. So I hate words like normal, because there's a range of what normal is, of course. But your bladder, it's meant to be a reservoir. That's its job. Fills and it empties, fills and it empties. That's its whole job. So it would be typical that people would pee, say, every 2 to 3 hours they're awake on the whole. This should expand a bit like a balloon as it fills. And when you go to pee, it should contract back to normal. So some people, they will have a consistent kind of urge to pee, and it often takes a long time to develop. It's not something that just happens overnight. People that have a bladder infection, of course, will also have an urge to pee, but also it might burn to pee, or it is cloudy urine, that kind of thing. There's often other indications of an infection. But in the absence of that, some people over time, there's no infection. They just can get to the point that they have a real frequency or an urge to pee that either doesn't settle, or they'll be fine, and then they have to pee right now. And they may not make it, and they might be leaking a bit of urine when they're still not sitting completely on the toilet. And these things, again, you get to work on the pelvic floor, and there's lots that can be done to help train this. So if we're talking frequency and urgency here, again, here's the bladder. And here's the magic as far as I'm concerned. The obvious reason for doing Kegels and strengthening the pelvic floor is to build this kind of strength from below, and to more effectively squeeze around the urethra, the vagina, and the anus, like tighten up the sphincters, and there's you get to work strengthening things, and they will respond with the work. But the bladder, your brain runs your bladder. and you don't have voluntary control over that. You totally have voluntary control over your pelvic floor group of muscles. And in life, they work opposite to one another. So when your bladder contracts, your pelvic floor muscles relax. And when your pelvic floor muscles contract, it makes your bladder relax. So with peeing, just normal peeing, because people don't tend to think too much or deconstruct urination, but if you know what I mean, when you sit to pee or stand for men, doesn't matter, but right before the flow starts, like you sit down right before the flow starts, there is an automatic letting go through your pelvic floor. And there's your brain going, okay, I'm in the right place. Now's my time. So that letting go or that relaxation through the pelvic floor, these have to be opposite. That release makes your bladder contract and it opens the sphincter and you pee. So your job when you're peeing would be to keep this relaxed so that your bladder stays contracted and you empty your bladder completely. So when you're actually peeing, that's not your moment to keep doing your Kegels. There's people that have been told to just stop your pee when you like to do your Kegel exercises, which again, to do that every now and again, no one's broken, like that's fine. But as repeated Kegel training or daily practice, don't keep doing it that way because your pelvic floor muscles are meant to stay relaxed when you're peeing so that your bladder empties completely. So, but the opposite is true as well. If we are trying to use your pelvic floor to train the bladder to be a better reservoir and help people space their pees apart more, so I will see people that commonly get in front of me because they might pee every 30 minutes they're awake and it runs their whole life. Their world can become really very small. They won't go out for dinner because what if the bathroom's broken or they're embarrassed to be seen getting up peeing 3 times in the course of a meal. They will know where every bathroom is and it runs their whole life. And so just again, the mechanics behind reversing that pattern a bit would be if someone pees and the goal would be to space it apart enough or get the bladder used to holding more urine so that it expands and it starts to signal that urge less. So the training for that would be, if somebody pees and then an hour or less later they have to pee again, I would say do some of the Kegels then, so that that reflex comes into play in the sense that if you're doing your Kegels, that's saying to your bladder, oh, I want to relax and fill. And if it wants to fill, it doesn't want to pee right then. So it can diminish that urge to pee. And so there's strategies around that to train your bladder to start to hold more so that you can space your pees apart differently. And that can be quite individualized with people and their different situations. So pelvic organ prolapse, that is an issue with women. And now I'm bringing the uterus and the vagina back into play. So if a woman is standing, and this being the bladder, uterus sits literally on top of the bladder, and then this is the vagina behind it, the anus would sit back here. And so because people, as a general statement, their base or support system often isn't very strong, and these organs have a sling, kind of up to the sides through the lower abdomen and perineum with ligaments. And so over decades, those can start to stretch out as you don't have a very good base of support. So what can happen is that the uterus or the bladder can start to descend down the vagina, and that's called a prolapse. And it's graded in the sense that grade 1 is a bit of a descent, grade 2 is more so, grade 3 is even more, and grade 4 is the most extreme kind of version of the lowering of the organs. And so if somebody is doing Kegel exercises, you're helping to kind of lift through that system. And evidence shows, a Cochrane review, those are people that do kind of a meta-analysis on various topics. And it shows that pelvic floor physiotherapy can improve a prolapse by 1 grade. I've seen it where it improves by more than 1 grade. And at the other end of that, of course, there are people that would have to have surgery because it's just kind of descended too far, and they have different surgeries or different techniques, but basically they would help kind of sling the bladder or the uterus back up towards the better position. And those people, even if it has to be surgically corrected, it is in their best interest to get to work on their pelvic floor and help build a better base of support, because gravity, like after a couple of years, that can start to descend down again. And I guess part B of that is everything that we've spoken about so far, very purposely is specifically addressing the pelvic floor itself. And as I had said at the beginning, the pelvic floor in life never works on its own. It is always coordinated with other parts of the core. And so it's most important, but incomplete, to just do Kegel exercises and work the pelvic floor in isolation, just because it doesn't ever do that in life as you're moving around, kind of however. So anyone who does any kind of core exercises, the pelvic floor isn't going to move on its own. But if you do those same core exercises where you purposely bring in the pelvic floor as well, that builds a stronger core. And so professional athletes or Olympians, like the elite, the ones who have to follow the research, they do a lot of pelvic floor work, because if you, as I said, if you will get a better core if you add the pelvic floor or doing Kegels at the same time as other core exercises. And that's a very purposeful thing. It doesn't just happen on its own. So my point is, someone who is looking to improve a prolapse, it's in their best interest, again, to get to work on the core with the pelvic floor as well, to kind of lift through that whole symptom or system. So dyspareunia, the definition of that is pain with penetrative sex. And that can be really quite extreme for women, but it wouldn't, the people often that get in front of me, they couldn't insert a tampon. They couldn't ever have a pap smear, like even a pediatric speculum isn't going to be able to go in. And it's not something like that the person who struggles with this kind of pain, it's not that their vagina is particularly different, or it's too small. It's that their brain doesn't allow this area to release appropriately. So in part, these are the people that have difficulty letting go through their pelvic floor. And you would treat this totally differently. There's not only different stretches that can be done, and often people have to work into that. And often perimenopausal or menopausal women can start to have kind of pain or discomfort with penetrative sex. Sometimes people who've had surgeries or different treatments for cancer can develop pain in this area. So again, these muscles also respond to stretching like other muscles. And if your brain, in part, it's local stretching, and it's teaching the brain that contact and movement and release through there isn't harmful or damaging, but their brain is learned to kind of keep that amped up. And part of it is training the brain to calm down, as well as kind of local stretches to the area itself. Lastly, I guess on this is training the pelvic floor. So we've talked a lot about why you would do Kegels and what they can be helpful for. Let's talk about how to do them here, just in our last kind of 5 or 10 minutes. So we want your brain to stay present and focused. You know, your brain has literally a map of all body parts on it. It's called a homunculus. And the more you use something, it can change that. Somebody who, say, is a professional pianist who does fine motor movements with their fingers for hours every day. They've developed these huge fingers on their brain map, and it takes up more space and it wires more effectively to the nearby parts. The word is neuroplasticity for those of you who have learned about kind of changing the brain. And so the more your brain can pay attention to something, that's where things change peripherally. So bottom line, because I want your brain to stay present and focused, we are all very big with imagery. So weird as this sounds, a proper Kegel is, say you have a ping pong ball sitting right outside your vagina and you want to pull it inside. It's a lift. Or if it resonates better for your brain, say you are peeing and you stop that flow midstream. It's the same lift. Now, as I was just saying, to do that every now and again when you're peeing, if you just want to see if you can stop the flow, fantastic. But don't keep doing that repeatedly or daily as training, because your pelvic floor is meant to stay relaxed when you're peeing. But we're very good with the imagery. So either way, a proper Kegel is like the ping pong ball and you're pulling it in. And that imagery is at the front aspect. But the pelvic floor, as you know, goes front to back. So really a complete Kegel or a fully proper Kegel would be both the ping pong ball sitting right outside your vagina, but also say you have a marble sitting outside your anus and you want to pull that in at the same time. It's the front and the back together and then just letting it go. So one exercise is called pulses, but it's not boom, 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 boom really fast. It's like you would lift front and back, the ping pong ball and the marble, pull it inside for a couple seconds, then let it go a couple seconds. It's on a couple seconds, off a couple seconds. And you'd want to repeat that just on and off like so for maybe a minute. A second one would be the same lift, front and back, but now you want to hold that. And I would see if you could do 10 seconds where you're keeping that intensity on throughout that whole duration. Purposely let it go a couple seconds, turn it on, hold, let it go. And you'd want to do several of those in a row because that's more endurance. And so if you were doing that, you can see that if you were doing both pulses for a minute and a minute or two of these longer holds, if you were making that happen every day, it's not super onerous. It just is a little bit of work that needs to be consistent, and that's how you would move ahead. So there is also, because of this pressure differential that we talked about earlier, there is a particular breathing pattern. And to be honest, when I'm working with somebody, it's a rare day that I would teach somebody Kegels and talk with them about proper breathing in that same session, because often people are just learning how to do Kegels. Often I just want their brain to start to get a good connection with their pelvic floor before I start giving them more to think about, right? So there's lots of people that it might make their brain explode a little bit, or if you're thinking too much about breathing, you'll no longer engage your pelvic floor appropriately. But I will mention that core breathing, if you're doing Kegels, or let's just take that pulsing one as an example. So if you're sitting here and you're trying to lift front and back, as I've just mentioned, and then let it go, it's going to be people's natural inclination to want to inhale as they do their Kegel and then exhale to let it go. And I would say it manages the pressure system if you do the exact opposite. What I would get people to practice and kind of layer in the breathing as they get good at Kegels would be, as they're doing their Kegel, as they're lifting up, to breathe out. So you would want to exhale Kegel and inhale, let it go. Exhale Kegel, inhale, let it go. And you'd want to do that for about a minute. So if you are trying that here as I'm just talking, I will also say that often when I'm starting to work with people, I don't get them to start doing these Kegels sitting up because you're lifting against gravity and there's other kind of core muscles that need to be on. It is easier if you're starting your training or if you're starting to just get the sense of doing it properly and making sure you can do a whole bunch in a row. It's probably better to start lying down because gravity is eliminated and everything else through your core is relaxed and supported. And there's the strongest contraction you're going to get. And it doesn't have to be on the floor. You can do it on your bed. The surface is unimportant. But I would say get good at these first with the breathing pattern, lying down. But the goal would be to do it sitting up or standing because that's how you live life. So that's a more functional position. So don't worry too much if you're not able to kind of string that breathing in. As I said, I wanted to mention it here just so that people are aware that breathing does matter because it manages the pressure system. But as I said, I often don't start people there. So again, somebody that does any kind of core exercises where you're working your abdominals or your obliques or your deep back muscles in different ways, people have to learn how to bring in their pelvic floor. So those of you, say, who are familiar with a bridge, as an example, a bridge would work all of the muscles at the back and your butt muscles. And if you were lying on your back, you had your knees bent and your feet on the bed or a mat, and you push down to lift up your hips, and then you're holding that there. So that's called a bridge. And you would feel that as you held that position for a minute or so, you'd feel that in your back muscles and your butt. And what I would say to you is while you hold that position, try and do a bunch of those Kegel pulses at the same time, because you'll see that it's not going to happen on its own. But if you think to bring that in, that's what I mean when I say you can do other core exercises and then add your pelvic floor itself. So that would be kind of the things that we would work on for different pelvic floor related issues. And so again, just as a bit of a summary, these are the kind of things that pelvic floor physiotherapy can be helpful with. And I will say that it is, 10 years ago, certainly, I would say 90% of the people who got in front of me for various pelvic health reasons, men and women, did so through their own research or word of mouth. Now physicians and specialists, certainly, they're much more educated on how beneficial pelvic floor physiotherapy can be. And so I see lots of people referred from their family doctor, or certainly urologists or gynecologists, urogynecologists, gastroenterologists even. So they're much more educated in this area. And the best education comes from their patients, where they can go back and say how pelvic floor physiotherapy or working this has changed their symptoms. That's really the best way to summarize it for them. So thank you all. And I'm happy to answer any questions that people have.